Many people think that preparing for surgery consists only of preoperative tests or fasting before anesthesia. In reality, science today tells us something very different. To best prepare for surgery, the body and mind must be ready to face surgical stress. This approach is called prehabilitation or pre-rehabilitation and serves to improve the patient's physical strength, nutrition, and psychological stability before surgery. In this video, we'll see how to prepare concretely with strategies based on scientific evidence. This brief presentation is based on several articles, some of which I'll provide references for. In this video, I'll explain what prehabilitation is, the physical training to prioritize before surgery, the type of diet to favor, why smoking and alcohol should be avoided, why the psychological component should be considered, and the key concept of the microbiota. Finally, I'll present a final checklist. Each of these points would obviously deserve a dedicated video, but this is a project I hope to complete soon. The purpose of this video is to give you some insight and food for thought, which you can also discuss with your family doctor, physical therapist, and, of course, your surgeon. Prehabilitation originated in oncology hospitals, but is now applied in many other fields: orthopedics, abdominal, cardiovascular, and thoracic surgery. The goal is simple: to increase the body's functional reserves before surgery tests them. In other words, surgery, whatever it is nothing more than a source of stress for our bodies. During an operation, the body faces significant stress. Oxygen consumption and blood sugar levels increase, and an inflammatory response is activated. If the patient starts from a more stable physical condition, recovery is quicker, complications are fewer, and healing is more efficient. Exercise is the cornerstone of preoperative preparation. Numerous studies demonstrate this. Even just 3-6 weeks of regular activity improves cardiopulmonary function and reduces postoperative complications. What activities are recommended? Aerobic training, brisk walking, cycling, or swimming for at least 30 minutes, 3 or more times a week. Strength training, exercises with elastic bands or small weights to strengthen the arms and legs. Breathing exercises, useful in preparation for thoracic or abdominal surgery, but also in orthopedics to improve lung expansion. In orthopedics, where postoperative mobility may be limited, arriving with strong muscles and good overall tone dramatically reduces recovery times. In the case of orthopedic patients who may be undergoing hip or knee replacement surgery, the ability to move may be severely limited due to joint pain. In this case, obviously, the recommended exercises are those that relieve stress, such as swimming, cycling, or gym exercises. After explaining your concerns and the purpose of the workout, ask the staff to prepare a personalized program for you. I would therefore probably recommend joining a gym at least a month before surgery, and ask for a personalized program to include muscle strengthening and breathing exercises, but without overloading your joints. Food is our main medicine. Proper nutrition in the weeks leading up to surgery is one of the most important factors in reducing complications and improving recovery. The guidelines indicate a protein intake of at least 0.8 to 1.2 grams of protein per kilogram of body weight per day for healthy adults, or 1 gram per day for the elderly, up to 1.6 to 2.2 grams per day for athletes, under medical supervision to avoid kidney problems. Just to give you an idea of what this means, I'll point out that 120 grams of salmon corresponds to approximately 25 grams of protein. 150 grams of turkey, or lean beef, corresponds to up to 35 grams of protein, while 1 egg contains approximately 7 grams of protein, and a scoop of protein powder contains approximately 24 grams. Greater attention should be paid to high-quality sources, such as fish, lean meat, eggs, legumes, and low-fat dairy products. If you have dietary restrictions, use oral protein supplements or supplements with arginine, omega-3s, and nucleotides. Avoid prolonged fasting. Complex carbohydrate-based beverages are often permitted up to 2 hours before anesthesia. In this case, however, You should discuss this with your anesthesiologist during your pre-admission visit. Regarding the much demonized carbohydrates, we must distinguish between so-called refined carbohydrates, such as those found in white bread, sweets, sugary drinks, and refined pasta, which cause an increase in the glycemic index and therefore insulin spikes with the associated release of pro-inflammatory cytokines, amplified especially by those who are overweight or insulin resistant. Complex carbohydrates, such as those found in whole grains and legumes, are a slightly different story. They offer a slow glucose release and a higher fiber and antioxidant content, which also stimulate and nourish the so-called gut microbiota, which has an anti-inflammatory effect. It's therefore not just a question of how many carbohydrates we consume, but also of the type of carbohydrates we consume. In other words, it's absolutely right not to overdo their intake. But above all, let's distinguish between the types of carbohydrates we can consume with less anxiety and those that should be avoided, such as refined sugars, white bread, and so on. I hope to soon involve a nutritionist colleague who can discuss this topic with you. I also wanted to mention the benefits of turmeric, or more precisely, curcumin, its main active ingredient. Turmeric induces significant reductions in certain markers of oxidative stress, proving especially effective in cases of rheumatoid arthritis, osteoarthritis, metabolic syndrome, and ulcerative colitis. Its effects appear to be comparable to those of low-dose, non-steroidal anti-inflammatory drugs, but obviously with fewer gastrointestinal side effects. However, curcumin has practical limitations, primarily related to its poor oral bioavailability, as it is poorly absorbed when taken alone. To increase absorption, it is recommended to combine it with black pepper, or, at least, take it with meals containing fat to promote absorption. Other foods that can help reduce inflammation include oily fish, such as sardines, anchovies, mackerel, herring, and tuna. Some fruits also have anti-inflammatory properties, including blueberries, pomegranates, citrus fruits, kale, spinach, as well as ginger, garlic, onion, and rosemary. Two habits dramatically interfere with healing, smoking, and alcohol. Smoking reduces oxygen supply to tissues, damages blood vessels, and slows healing. Quitting at least 4 weeks before surgery reduces the risk of respiratory and skin complications by 50%. Alcohol, even in moderate but regular doses, weakens the immune system and alters protein metabolism. Quitting alcohol 2 or 3 weeks before surgery has a significant impact on the safety of the procedure. It is also essential to discuss any chronic medications with your doctor. Anticoagulants, which must be stopped a few days before surgery and resumed a few days afterward. Corticosteroids, medications for diabetes or blood pressure. Immunomodulatory drugs, whose use significantly increases the risk of delayed healing and postoperative infection. It is always advisable to disclose any health problems to your surgeon. So please click the link at the end to watch another video where I'll show you how to prepare for your appointment with your doctor. Before surgery, the patient should achieve optimal metabolic balance. This means keeping blood sugar under control, correcting anemia, if present, by having blood tests performed by your doctor, treating any chronic infections, such as gingivitis or sinusitis, which can be a gateway for bacteria, increasing the risk of infection of prosthetic devices, such as hip, knee, or ankle ones. A balanced body responds better to anesthesia and reduces the postoperative inflammatory response. Preoperative anxiety isn't just a feeling, it has measurable biological effects. It increases cortisol, alters blood pressure, and amplifies the perception of pain. For this reason, it's helpful to receive clear information about the procedure and what to expect afterward over the following weeks and months. Practice breathing or relaxation techniques. Use mindfulness or guided imagery. These are two different but complementary mental practices. Mindfulness focuses on bringing attention to the present moment, while guided imagery focuses on thinking about a positive and pleasant scenario. Psychological serenity positively influences every stage of recovery. The microbiota is the collection of all microorganisms, bacteria, viruses, fungi, and protozoa that live in a specific environment of the human body. In short, it is a universe of microorganisms found primarily in the intestine. In this case, we speak of the intestinal microbiota, but it is also found on the skin, in the oral cavity, in the lungs, and in the genital tract. The main functions of the microbiota are 1. Digestion helps break down nutrients and fiber that the body can't digest on its own. 2. Production of beneficial substances, such as vitamin K and some B vitamins, as well as the production of short-chain fatty acids. 3. Immune defense prevents the proliferation of pathogenic bacteria and modulates the immune response. 4. Influences mood, stress, and behavior through a real communication with the brain, also called the gut-brain axis. When the microbiota is balanced, it's called eubiosis. A balanced gut microbiota supports the immune system and reduces the incidence of postoperative infections. When the microbiota is altered, for example due to an unbalanced diet, stress, antibiotics, or other illnesses, it's called dysbiosis. An altered microbiota can contribute to various gastrointestinal, metabolic, or inflammatory diseases. Some studies suggest benefits from taking probiotics and prebiotic fibers in the 2 weeks before surgery. Probiotics are live bacteria found in kefir and yogurt with live cultures, while prebiotic fibers nourish the good bacteria we all have in our gut. Foods containing prebiotic fibers include garlic, onion, oats, unripe bananas, and legumes. They're not yet universally recommended, but they represent a new frontier in surgical preparation, with the aim of multiplying the good bacteria already present in our gut. Here's a practical summary for those preparing for surgery, which should be discussed with your doctor. 1. Exercise regularly every day, even just with brisk walking or cycling. 2. Follow a balanced protein diet and correct any deficiencies. 3. Stop smoking and drinking alcohol at least 4 weeks beforehand. 4. Monitor your blood sugar, blood pressure, and current medications. 5. Sleep well and manage stress. 6. Approach the surgery actively, not passively. Surgery isn't just a technical procedure, it's a challenge for the entire body. Striving to be prepared means reducing risks, improving recovery, and returning to your life more quickly. It's a process that requires at least several weeks of preparation, requiring you to review your physical activity and diet, perhaps with the help of a nutritionist, and never neglect your emotional well-being. If for any reason you don't feel ready for surgery, such as anxiety, a history of depression, or other emotional issues, discuss it with your surgeon, who should be informed of this crucial aspect. Thank you for subscribing to the channel. It costs you absolutely nothing, but for me it's an important support to continue making these videos, which I sincerely hope will be useful to all of you. Thank you all.